The Office of Minority Health and Health Equity, or OMHHE, is dedicated to our vision of health equity for all Virginians. Health equity is defined as achieving the highest level of health for all people. Our mission is to identify health inequities in society and their root causes and address these disparities by promoting opportunities to be healthy. OMHHE is home to 3 state offices: the State Office of Rural Health, the State Primary Care Office, and the State Office of Minority Health. Together, we strive to assure the availability of quality health care to low-income, uninsured, isolated, vulnerable, and special needs populations, and assist Virginia rural and urban communities in building health care delivery systems. To achieve our mission, OMHHE has a number of priority goals, including identifying health disparities and inequities as well as health care shortages in Virginia, empowering communities to promote health equity, influencing health care, and public policy in order to promote health equity, enhancing the capacity of public health and our partners to promote health equity, and promoting equitable access to quality health care and providers. These goals are achieved through certain roles and functions our staff fulfills, including data analysis to identify health disparities and inequities and healthcare shortages in the population, OMHHE programs designed to equalize the health opportunity in Virginia, community engagement projects created to collaborate with other community organizations and individuals to promote health equity, multicultural resources to assist minority populations in attaining quality health services, operations including securing grant funding and managing our budget, and educational tools to provide information and updates to help individuals and communities promote health equity. In advancing health equity for all Virginians, the OMHHE utilizes funds from 9 state and federal grants. Our budget is managed by our operations team, who handle all internal and external business matters, including managing our finances and securing grant funding for each fiscal year. In order to identify the highest need communities in Virginia, our data analysis team designates 2 types of high priority target areas: health professional shortage areas and medically underserved areas and populations. These areas are identified using spatial clustering techniques and formatted into maps to show where healthcare shortages exist in Virginia. The HPTAS have shortages of primary health care, dental, or mental health providers, and MUAs and MUPs have shortages of primary health care providers. These designations help to further direct our efforts to understanding and eliminating the health disparities and inequities in these communities. OMHHE programs are designed to work towards a solution to the healthcare barriers that exist in the high priority target areas in Virginia. Our programs support efforts to improve recruitment and retention of health professionals in these areas and assist in coordinating the health interests of rural and urban communities. In an effort to support accessible healthcare services in Virginia's rural communities, the OMHHE manages 2 federal rural hospital programs: the Medicare Rural Hospital Flexibility Grant Program and the Small Rural Hospital Improvement Grant Program. Both programs focus on attaining and maintaining quality and accessible health care in rural areas in Virginia. Part of the programs include supporting the conversion and designation of small rural hospitals to critical access hospitals and further integrating emergency medical services in rural areas. The Small Rural Hospital Improvement Grant Program, or SHIP, currently provides funding to 24 small rural hospitals in Virginia in order to ensure accessible health care to rural communities. Of these 24, 7 hospitals are federally designated critical access hospitals, exempting them from certain costs and providing cost-based reimbursement in order to ensure they can provide accessible health care services to rural communities. The Commonwealth of Virginia offers several health workforce loan repayment and scholarship programs to attract primary health professionals to Virginia's underserved areas. These programs not only assist with paying down outstanding medical education debt, but also provide individuals an opportunity to become part of a community and provide care to deserving populations. Our office either manages or provides assistance to each of these programs. One incentive program we manage is the Virginia State Loan Repayment Program, which repays outstanding medical education debt in exchange for service in a federally designated HPSA in Virginia. The United States Department of Human Services, Health Resources and Services Administration, Bureau of Health Professions provides federal funding up to $400,000 per year for a maximum of 4 years for the Virginia State Loan Repayment Program, and requires a dollar-for-dollar community match from a practice site or public-private entity. This program is available to a variety of primary care, dental, and mental health professionals, including primary care physicians and physician assistants, dentists and dental hygienists, nurses, psychologists, social workers, counselors, and therapists. OMHHE also manages Virginia's Conrad 30 J1 Visa Waiver Program in an effort to provide healthcare professionals in Virginia's underserved areas. The waiver program is for foreign national physicians requesting a waiver from the 2-year home country physical presence requirement. The program waives this requirement if the applicant agrees to serve for 3 years in an HPSA or MUA in Virginia. Priority to the 30 available slots in this program is based on submissions received in the highest need areas in Virginia. To enhance the number of nurses practicing in Virginia, the OMHHE manages 3 nursing scholarship programs: the Mary Marshall Nursing Scholarship Program, the Nurse Educator Scholarship Program, and the Nurse Practitioner Nurse Midwife Scholarship Program. The Mary Marshall Nursing Scholarship Program is for students earning an RN or LPN degree in Virginia and offers a scholarship award in exchange for service in Virginia. The Nurse Educator Scholarship Program is for graduate students in a master's or doctoral nurse educator program and offers a scholarship award in exchange for teaching service in a nursing school in Virginia. The Nurse Practitioner Nurse Midwife Program is for graduate students in an accredited nurse practitioner or nurse midwife program in designated schools and offers a scholarship award in exchange for service in an MUA or HPSA in Virginia. To help Virginia healthcare providers locate employment opportunities and assist employers in finding healthcare workers, 3rnet.org is also available as an additional free placement assistance service. The site assists healthcare professionals in finding jobs in rural and underserved areas in Virginia. Visit 3rnet.org for more information and to utilize this resource. In order to raise awareness on health equity issues and support organizations and individuals in policy change, the OMHHE designs, implements, and supports internal and external community engagement projects to ignite discussion and promote change in regards to minority health and health equity. We collaborate on these projects with multiple state and local health departments, other state agencies, and community partners across the Commonwealth interested in enhancing health equity. Products of the projects have proved influential in educating Virginia communities and implementing change in regards to health equity. In an effort to strengthen and support the quality and access of healthcare in Virginia's rural areas, the OMHHE is part of a collaborative community engagement project focused on implementing the Virginia State Rural Health Plan, a 3 to 5 year strategic plan designed to strengthen the healthcare infrastructure in rural areas. The plan is led by the OMHHE, the Virginia Rural Health Resource Center, and the Virginia Rural Health Association, and includes over 50 prominent rural health partners. The plan seeks to provide analyses and strategies that will lead to improvements in rural health, not solely improvements in the delivery of healthcare services, and focuses on access to care, the healthcare workforce, and healthcare quality and data in Virginia's rural areas. Mosby Court Community Health Connections, or MCHC, is a local OMHHE community engagement project in Mosby Court, a public housing community in Richmond. MCHC is a coalition of members and organizations focused on identifying a plan to address social determinants of health and health disparities in Mosby Court. The OMHHE supports this coalition by providing technical assistance and leadership in identifying and addressing social determinants of health, as well as implementing strategic planning to eliminate health inequities. Since its conception, the partnership has resulted in a resource center in one of the housing units, a photo voice project conducted with middle school children to identify community barriers and enable factors for good health, and the new Youth Health Equity Leadership Institute, which will provide youth an opportunity to be leaders against health barriers in their neighborhoods. The OMHHE also focuses on assuring the availability of quality health care to minority groups in Virginia through a variety of multicultural resources. The Limited English Proficient, or LEP community, is one minority group the OMHHE strives to support by providing culturally and linguistically appropriate services, or CLAS, and offering education and training to health professionals on unique healthcare considerations when working with the LEP individuals. One multicultural resource our office provides is the CLAS Act website, clasactvirginia.org. The site is a resource database that supports culturally and linguistically appropriate service delivery. By entering a keyword, the year of publication, or the target population of interest into the search engine, you can easily find useful articles, websites, organizations, and documents relevant to the specific class-related issues. Medical interpreting is a necessary resource for LEP populations, and new tools are always being developed through groups like the Virginia Medical Interpreter Collaborative, or VMIC, to improve access to these services. VMIC is a statewide network and collaboration of community partners passionate about meeting the needs of the LEP community. Members explore ways to collaborate and provide resources and support for quality medical interpreting practices in Virginia. The Virginia Medical Interpreter Database, or VMID, is a new CLAS initiative and a result of the Virginia Medical Interpreting Collaborative. It serves as a means of both identifying qualified medical interpreters throughout Virginia, as well as providing an avenue for trained medical interpreters to offer their skills. The site also provides links to additional CLAS resources. In order to provide education and updates on health equity, The OMHHE develops and maintains numerous educational tools to support individuals and communities in promoting health equity, and provides updates on health equity matters using communication resources like our website, blog, and Facebook page. OMHHE utilizes the PBS documentary series Unnatural Causes: Is Inequality Making Us Sick?, as a tool to educate communities on the effects of health inequity. The series sheds new light on the nation's debate over health and what we as a society can do to reduce our health disparities. To encourage community involvement, the OMHHE supports local health districts in conducting screenings of the series and provides informational resources for communities to use to formulate discussions on health equity in their areas. To ensure our work is being implemented within the Virginia Department of Health, the OMHHE offers the Cultural Health Training Series to VDH's 3,500 employees. The training series is diverse and designed to uncover barriers to multiculturalism at VDH, promote cultural sensitivity in VDH programs, and build VDH's capacity to promote health equity. The OMHHE published the 2012 Virginia Health Equity Report as an educational tool to highlight audiences on health inequities of varying socioeconomic, racial, and geographic backgrounds in Virginia. Its intended audiences are public health and medical professionals, along with policymakers, advocates, and communities interested in broad strategies and policy solutions to creating environments that promote health equity. It recommends various strategies and collaborations and provides a foundation on which partners and stakeholders can develop new plans for promoting health equity. Primary features of the report include Virginia demographics, health disparity cost analysis, impact of health disparities, the Health Opportunity Index, and recommendations and conclusions. The Health Opportunity Index, or HOI, is a primary feature of the 2012 Virginia Health Equity Report and an additional educational tool to show audiences the effects of social determinants on a community's health. The index is comprised of 10 health opportunity indicators and reveals Virginia's population areas to reflect higher or lower health opportunity depending upon the levels of each indicator. Here's the Health Opportunity Index calculated through the demographic data collected in 2009. The dark blue areas represent populations that reflect a high health opportunity rating based on the 10 HOI indicators. The light yellow areas represent populations that reflect a low health opportunity rating based on the same indicators. Areas calculated to have a low health opportunity show us where our work is most needed, while the areas calculating the high health opportunity ratings offer us data on how to improve. The OMHHE manages several communication resources to effectively relay information and updates to our audiences. Our resources include the OMHHE website, the Virginia Rural Health Plan Facebook page, and the Health Equity Matters blog. Click on the links provided to visit these sites. Thank you for taking the time to learn more about our office. We hope you will visit these links for additional information.